Rob DiMartino here with Superior Health Solutions. We wanted to make this video today. If you search this out, you have all the symptoms that pertain to thyroid, and maybe you've even gotten your thyroid checked and been told everything is fine, and we see this absolutely every single day in the clinic. You have to understand, thyroid is probably the most underdiagnosed or misdiagnosed health problem that we are seeing, and it's massively important. You have to understand that every single cell in your body will use thyroid hormone. And the traditional tests that we're taught in school and that you probably had done for yourself lab work wise don't always show an underlying thyroid problem. People ask me all the time, how do you fix these things? What do you look for? We're going to go through this piece by piece, and I'll keep it as simple as I can, but you have to understand what you're looking for, because there's about 7 or 8 different variations of what can go wrong with your thyroid, and a lot of the traditional lab testing is only maybe testing for 1 or 2 of those. So it's about understanding this. That's what this video is about. Again, won't get too technical, but I want you to have the understanding, because once this stuff happens and you understand where you're at, then the route to proceed becomes really obvious. This is about gathering information to empower you to make the right call, what you need for your thyroid, and to gain your health back, because there's going to be a lot of symptoms here. Fatigue, everyone talks about the weight gain, the hair loss, the brittle nails, but joint pains, neuralgias, pain, just discomforts, that general, I don't have that same get up and go, cholesterol problems. Look, these are all things that relate to your thyroid, and you need to know about this stuff. It's important. So let's start at the beginning. First step here is right at the very top, we have your pituitary gland, okay? And your pituitary gland is going to tell your thyroid to create thyroid hormone by using what we call TSH, thyroid stimulating hormone. Now, you've probably seen this tested on your lab work, okay? Now again, on lab work, this will be a range, depending on the lab you go to, anywhere between 0.4 to 4.5. And in reality, that's way too big of a range. You really want this number in a much tighter range, somewhere between 2 and 3. It's an optimal range, not a medicatable range, okay? So now your thyroid's going to create, after the TSH, your thyroid's going to come down here and it's going to create T4 hormone. And T4 is the inactive form of the thyroid hormone. T4, now sometimes you'll even get this measured, maybe, maybe not. T4 then is going to go down here to your liver and your stomach. And that's where about 80% of this is going to get translated over, and this is going to get made into one of 2 things. You're either going to get T3, which is the active form of thyroid hormone, or you're going to get what they call reverse T3. Okay. These are the steps. In this case scenario, what you're going to typically see is they're going to measure TSH. You may be out of range, but it's going to be within the medicatable range where they can't diagnose it, so it's not going to be optimally functioned, and you're still going to have thyroid symptoms. Then your thyroid has to create T4. For the majority of people that we see, the problems then lie outside of this. Maybe your thyroid does get enough TSH. Maybe the T4 does get inactivated. But then when we come to the liver and the stomach, it doesn't convert over to active T3. If people are under a tremendous amount of stress, the body, as a protective mechanism, will start to, instead of make T3, it'll make reverse T3, which blocks the action of T3. That's because of an associated adrenal problem, which is a video for another time, but a really important thing when you're looking at basically the right-hand man towards your thyroid is your adrenal gland function. So in this case, we have to make sure that the T4 is actually converting over to T3. And if not, like I said, if there's a cholesterol issue here, if your liver's not functioning properly, it's not going to be doing that. If there's a digestive issue, again, you're not going to be converting it over. And at the end of the day, this would be like going to a gas station, having the gas station have all the gas in the world that you need, but you can't get it into your car. It would be like dumping gasoline on top of your car. It's not going to get inside. The T3 is not going to be created. It's not going to be able to get to your cells, and then your body's not going to be able to use it. So it doesn't matter if you have everything you need. If you can't use it, you're not going anywhere. Now, the other big factor with this is at this point here, we have 2 autoimmune markers. So what does that mean? Autoimmunity basically means that your immune system has mistakenly identified your thyroid as something foreign, and it's attacking you. This probably represents a good 70, if not more % of the thyroid problems that we see. You have to have these 2 markers specifically measured, because the way you treat a thyroid that's an autoimmune, which you'll hear is Hashimoto's or Graves', the way you treat something like that, or the way you handle something like that, is very different than the way you would handle it otherwise if it was not an autoimmune issue. Because what you have to understand is your thyroid, you're really not treating the thyroid at all. And we don't treat any kind of gland or disease process in the office. You're looking for the things that cause that. Your thyroid is like an innocent bystander, but he's getting mugged by your immune system. Yeah, your thyroid hormones are going to be off. Yeah, you're going to have all the symptoms related to thyroid. But he's not the culprit. He's minding his own business, but your immune system's beating him down so badly that he's not going to be able to make those hormones that you need in order to function properly. Realistically, probably 90% of all thyroid problems are some sort of combination between these autoimmune markers and the inability of the body to make T4 to T3, and then even to get T3 inside the cell. And that happens when a person gets chronically inflamed. You know, everyone asks, well, how can these things happen? Well, they could have leaky gut, and that throws off their immune system, and that drives their immunity towards the thyroid crazy. They could have heavy metal toxins, or chemical toxins like plastics. Even flame retardants are really attacking towards the thyroid gland because they competitively compete with iodine. So your thyroid's going to have iodine receptors on it, and what happens is the metal will go in there, or any chemical will go in there and bind to that, and then the iodine can't bind, and you need iodine to create T4. Now here's the thing, don't rush out and get iodine supplements, because if you have autoimmunity, your body can react really negatively towards an iodine supplement for your thyroid. Again, when you're talking about trying to really get to the bottom of what causes these types of problems, the devil does lie in the details. And that's what you have to figure out. Yes, is there 7 or 8 different test measures that you have to run on this? Absolutely. But in that lies where you're going to find the absolute problem, so you know how to optimize your system to take the stress off of your body so that your thyroid can begin functioning normally again. It may be doing things to detoxify your liver so that your body can convert. It may be doing things to take the pressure off your stomach to stop the autoimmunity, or at least relax that reaction as much as you possibly can. Take the pressure off the system. These are the things with thyroid that we see every single day that don't get talked about. So when it comes down to treatment, and you know, in the next video and in the writing materials that we have associated with this, we're going to have all kinds of different options about how you're going to deal with some of these things, because it gets really specific. There can be combinations, but there is an answer for this, and it's an important answer, because all major chronic diseases will typically be found where there's a thyroid problem. It's rare to find a fibromyalgia patient who doesn't have an associated thyroid problem. It's rare to find a person who has another autoimmunity disease that doesn't have some sort of immune marker going along with the thyroid. This can not only make you feel better, but it's massively important to make sure that your body has enough energy to function, heal, and run at an optimal level for as long as you can. And that's what we call quality of life. This is where the rubber meets the road. I hope this video has helped you kind of connect some of those dots and given you the empowerment to take that next step. Call us today. One of our thyroid advocates will call you, walk you through the process. We can get you set up. This is something that you can solve. I hope this helps.